रेस्पेक्टेड रजिस्ट्रार सर डॉक्टर दीप राव सर, प्रिंसिपल से रिक्वेस्ट करता हूँ कि सर को हम फेलिसिटेट करें। सर सर फ्लैक्स लगी रहने दीजिए सर, बोलो। Yes. ज़्यादा समय न लेते हुए मैं डॉक्टर सुमित सर से रिक्वेस्ट करता हूँ कृपया आएँ और हमारे गेस्ट को इंट्रोड्यूस करें। सर
Good morning, everyone. Thank you, Dr. Vinamarji, for giving me this opportunity. I'm here to introduce Dr. Ananthrama Sharma, sir. Sir is a very renowned practitioner and a very famous personality from the field of Ayurveda. Sir is presently working as the Superintendent, Dean HR, and HOD of Panchkarma Department at All India Institute of Ayurveda, New Delhi. Sir has completed his PhD from Dr. S.R. Ayurveda University, Jodhpur, and has done his MD and BMS from Rajiv Gandhi University, Bangalore. Sir is expertise in the field of Panchakarma, that is purificated treatment of Ayurveda. Sir, contribution to the science is that Sir has conducted more than 1,500 camps in the name of Vamana Vasanta and Sharat Virachana, which is to make familiarize these Ayurvedic purificatory procedures among the Ayurvedic practitioners. Sir has done completed multiple research projects along with his MD and PhD work. Sir has also developed objective parameter for assessment of Antiki Shuddhi of Vamana Karma and development of portable Shirodhara equipment, and has validated tool to assess Samyak Snigdha Lakshana, and has, sir, has also done an integrative approach in treating Duchenne muscular dystrophy and spinal muscular atrophy in collaboration, funded by Italian Foreign Ministry and Department of Science and Technology. For this service, has been awarded multiple honors. Sir has received Panchashodhana Chikitsa Vishesha Sammana by Prabha Ayurveda Foundation in 2022. Sir has been awarded Vijnana Ratna Best Mentor Awards in 2019 by Vaidyaratnam Group. Sir has also received a fellowship on transitional medicine and integrative health from Savitribai Phule University in 2018. Sir is member of boards and councils in many universities and journals. Sir has also published a book called as Shodhaniya Siddhu and has a contributed chapter in Manibhadra Guda, Shodhana Rasayana and in psoriasis as a chapter contribution. Sir has done a lot of publications in highly indexed, especially Scopus Journal, and has conducted many workshops and skill development programs. The entire CVO, sir, runs more than 14 to 15 pages. So if I go on explaining that, the entire lecture will get over in that. So with your excuse, I invite such an eminent personality to deliver his speech and contribute, enhance your knowledge in the field of Ayurveda. I welcome you, sir.
नमामि धन्वन्तरिमादिदेवं सुरासुरवन्दितपादिपद्मम् लोके जरारुग्मृत्युनाशम् धातारिमीशं विविधौषधीनां चम्योमवातागनिवारिवन्दिं पञ्च प्रपञ्चात्मकदेहपात्रम् सन्तापसम्पातजराज्वरात्मम् नमामि धन्वन्तरिमादिदेवम् नवीननीलमुदिकान्तिकान्तम् शान्तं हरे द्वादशमाख्यमूर्तिम् पूर्तिं सतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवम्
Dhanvantari Namaha. Good morning, all of you. How are you feeling? Very good. First of all, I congratulate all of you for joining the course of Ayurveda, because Ayurveda is considered as a eternal science. So that is why it is called Ayurvedo Amrita. Okay. So I thank my beloved senior Dr. Manjunath NS for inviting me to present share few things for you people. And also I thank Dr. Sumit for the introduction also. Thank you. So Ayurvedo Amrutana. Ayurveda is considered as a nectar. What do you think about that? What do you know about Ayurveda? So you may be having some prejudiced understanding regarding Ayurveda. Ayurveda is science of Jadi Booty. Ayurveda is practice of folklore. Ayurveda is something mixed in the kitchen and done. Ayurveda is practiced in the roadsides, because many places in North India you can see that the Vaidya Maharaj keeping the tents and sitting on the roadsides, right? So this may be a vague idea you may be having, because your basic stream of understanding, learning. I think you are comfortable with English, because fine, because I am not much comfortable with Hindi. So in between I can speak also. So this may be the vague understanding what you people are having related with Ayurveda, but Ayurveda is much more than that. Ayurveda is not a medical science. If you came to learn Ayurveda as a medical science, you are wrong. Then what is that? Ayurveda is a science of life. So Ayurvedic, when you become a Ayurvedic Vaidya or Ayurvedic doctor, Ayurvedic physician, you are not only going to treat the diseases, but you are going to engineer the lifestyle of a human being. So it starts from the lifestyle modifications, dietary corrections, and then comes the last stage, any disease treating. Otherwise, Ayurveda is a science of life. The word meaning Ayurveda, the knowledge of life, itself denotes to this. So in this presentation, I'll be giving a brief about the Ministry of Ayush, what are the scopes of Ayurveda physician in future, like when you finish your course, what is the scope for Ayurveda, where the Ayurveda stands now in the entire world scenario, and few things about Panchkarma. Of course, being a Panchkarma physician, you can't stop the session without talking about Panchkarma. So these are the institutes to All India Institute of Ayurveda where I work presently. The right side you can see the All India Institute of Ayurveda New Delhi. It's a apex institute under the Ministry of Ayush. and it is at par with the All India Institute of Medical Science. And recently, in the month of December, we have got another satellite institute under All India Institute of Ayurveda at Goa also. Both are inaugurated by our Honorable Prime Minister Shri Narendra Modi ji. And in the New Delhi, we have only post-graduation and PhD studies. It's basically a tertiary care hospital with research and academic activities. And in Goa, it is something different. There is undergraduate courses also. This year, the course started also, and with a intake capacity of 100. Okay. So, Ayush healthcare infrastructure. So, what is the strength of Ayush healthcare infrastructure? It is not simple colleges or the some private institutes. Lot more than that. So, if you see the data dashboard which is published in the website of Ministry of Ayush, you can see that the hospitals and dispensaries in various streams of Ayush. Ayush means, it is a acronym word. Ayush, Ayurveda, Unani, Siddha, and Saugarika, Yoga, Naturopathy, and Homeopathy. So that is the expansion of the word Ayush. So all these health systems comprise under the Ministry of Ayush. So if you see, there are 3,859 hospitals are under Ayush Ministry, and dispensaries are around 29,000 dispensaries also. Apart from that, there are many other small players also are there into the field of practice of Ayurveda. So practitioners, as you know, the registered, qualified, institutionally qualified or non-institutionally qualified registered practitioners, around 71,000 registered practitioners are there, and institutional qualified registration practitioners are 59,000. Okay, so institutional qualified means those who have completed their formal education in the Ayurveda colleges after completing BAMS, post-graduation, and any PhD, etc. Then after that, they will be practicing. Like that, 59,000 practitioners are currently in. This data is as per January 2022. Okay, and the patient number of various National Institute of Ayurveda. So we have around 8 national institutes in that way. So National Institute of Ayurveda, Jaipur, and ITRA, Institute of Teaching and Research in Ayurveda, Jamnagar. All Indian Institute of Ayurveda, 2 are there. One is at Goa and another is at New Delhi, and National Institute of Ayurveda at Shillong, Northeast Institute. So, apart from that, there are National Institute for Siddha, National Institute of Homeopathy, National Institute for Sogarpa, Naturopathy, etc. Unani also. Okay, so in general, we can say the present era is the golden era of Ayurveda because the Ministry of Ayush is given a independent nature also. Previously, it was a single department under the Ministry of Health, but later in the last few years, the Ministry of Ayush is completely established, and in the last 2 years back, the Ministry of Ayush has given independent charge also, cabinet rank also. So that means that how much the government is giving importance to the ministry, Ayush systems, especially the system of Ayurveda. Okay, so the Prime Minister is also very much favoring towards the Ayurveda. But the only problem is the Ayurveda doctors are not equipped to meet that targets. Ayurveda doctors are not equipped to or updated to meet the targets of the ministry to reach to the spreading the Ayurveda worldwide. That is the problem. So it is your responsibility, being the undergraduate students joining to the Ayurveda. It is your responsibility to the science of Ayurveda to the next level. So this is the another few data you can see. Ayush education related with 780 Ayurveda colleges are present, and Ayush drug industry and Ayush industries. See, budget of the Ayush industry itself is 1,200 crore. So research these are the data available in the public domain. You can see the Ayush website. You can see all the details data of these things. The interesting factor was previously the total budget allocation for the Ayush ministry was very less. It was below 1,000 crores. But in the recent past, with the Ministry of Ayush has shown a exponential growth, and because of that, in the in the last budget year, the budget allocated was more than 3,000 crore. Okay. So some of the other initiatives like integrative centers for Ayurveda. So there are a lot of job opportunities in this aspect. Integrative center in the sense work together with the our counterparts in the Western biomedicine, modern medicine, what you call as allopathy. So Ministry of Health is also very much supportive in it. So there is a good cooperation which is happening in between the Ministry of Ayush and Ministry of Health. So that is why this was the photograph of inauguration of the Integrative Health Center at Safdarjung Hospital at Delhi. So you can see both Ayush Minister and Health Ministers together jointly they are inaugurating. This gives a very clear message. Yes, this gives a very clear message that how the government is approaching or how the government is planning to take the science into the next level. So apart from that, there are more than 14,000 Ayush wellness centers are established. Medical value to travel and tourism is another important area which the government is focusing. So each and every graduate who come out of the institutes have a lot of opportunities other than some institutional works, institutional job opportunities. They have a lot of self-employment possibilities also there. Also, the Ayush is entering to the Ayushman Bharat. Ayush Grid and the information technology related activities, and Ayush in defense. Recently, the Ayush was established in the defense. Since many years, it was discussions were happening in this direction, whether Ayush or Ayurveda can be incorporated in the for the benefit of defense personnel. But recent past, it was also established. Many cantonment hospitals or the AFMCs, armed force hospitals, also the Ayush doctors were appointed for the same purpose. Apart from that, Ayush startups, that is another interesting area. 2 days back, Saturday night, not Friday night, I attended a program also related with the Ayush startup. It is a Ashwagandha startup. It is the first Ayush unicorn run by Mr. Karthikeyan, a IIT person. They have started a World Ashwagandha Council. Inauguration of the World Ashwagandha Council was also happened, so that they are going to promote the Ashwagandha, one of the herbs in Ayurveda. We can call it as Indian ginseng also. For the promotion and marketing of this Ashwagandha worldwide, they have started a Ashwagandha Council. Similarly, apart from that, the drug promotion, the pharmacy opportunities are there, and bioinstrumentation opportunities are there, software opportunities are there, lifestyle coaching centers are possible. So many startups can be possible when you come out with some innovative or novel ideas. So coming to the one of the major portion of my presentation, the strength of Ayurveda, the strength of Panchkarma. You know the word Panchkarma, I think. Hmm? Yes. What is Panchkarma? What is Panchkarma? What is Panchkarma? Hmm? Hmm. कैसा करेंगे? हाँ. Hmm. 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 Very good. Very good. Very good. Anybody else? हाँ बताइए। हम्म हम्म वेरी गुड। हम्म 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 वेरी गुड वेरी गुड। So a platform. Good understanding. So because you might have seen the word panchakarma in many times in advertisement, the publicity of some hospitals, because it is very buzzword nowadays in ayurvedic field, panchakarma. Even the western people also very much fond of the word panchakarma, but many times panchakarma is misunderstood also. So so what you understand is not actual Panchakarma, but you have good understanding. Okay. So many times the common people, the people who not belonging to Ayurvedic field, they think that Panchakarma is oil massage or some oil girana sirpe, shirodhara, and some external potli karna, steam karna. ऐसा है ना? But it is not actually like that. It's an animation not working. Leave it. How to go back? Okay. So Panchakarma actually the purificatory procedures with the it is a unique concept of Ayurveda also. Okay. आयुर्वेद में एक ऐसा एक अलग कंसेप्ट है तो वो पंचकर्मा। अदरवाइज वी हैव एनाटॉमी सिमिलर टू वी हैव शरीर रचना, काय चिकित्सा है, जनरल मेडिसिन है। पंचकर्मा जैसा द कंसेप्ट ऑफ प्यूरिफाइंग द बॉडी और क्लेंसिंग द बॉडी with the help of herbs or with the various therapeutic interventions. There is no such concept is there any other medical system. If it is there, it might have gone from Ayurveda. Okay. So Panchakarma may mainly the purification done through the oral route, inducing vomiting. Another thing, purification done through the rectal route by performing the virechana or purgation, we can say. And as we mentioned, the nasal medications to instilling the medicines through the nasal route to remove the doshas from the upper route. And another one is the various kinds of enema therapies. There are called basti. So the introduction of the medicine through the rectal route through in the form of enema. In the as decoction enema are there, oil enema are there. Enema means the administration of medicine through the rectal route for the purpose of therapeutic use. Right? So similarly, Ayurveda also have various enema therapies. It is called basti. Apart from that, there is some more additions also like Shodhana, the removal of impure blood. Rakta Mokshana also sometimes can be considered under the Panchashodhana or Panchakarma. Okay, the bloodletting, again, there are various modalities are there like removing blood through the help of leeches and removing the blood with the help of needle puncturing or even direct venous suction also. Okay. So Panchakarma are the bio purificatory modalities, 5 in number are mainly Panchakarma. But again, for the preparation of Panchakarma, we need to have some external therapies, some other sub procedures also. So they are called Purva Karma or other Kriya Karmas. Okay. So what you see, the massage or the potali or the Shirodhara, all these are considered as Purva Karma or the other Kriya Karmas, other supportive Kriya Karmas for the Panchakarma. Okay. So I want to highlight how the Ayurveda or the Panchakarma works in patients. Okay, I'm not going to detail about the procedures or the medications, but I want to show with some of the photographs so that you can get inspired, you can understand the strength of the Ayurveda, you can realize the strength of Ayurveda, how Ayurveda is working in a person's life. Okay, so this is a person. I will narrate the story because if a clinician seriously involving in the patients, if a clinician seriously involving with patients, he can speak about the science days together. Even the PPT is not required because it is the pictorial memory what you are having when you treat a patient, right? For memorizing, there are two ways. One is the audible memory and the another is the pictorial memory. If you learn, just listen, maybe after sometimes you may forget that. But when you read, it becomes as a pictorial memory, so that it will be stays long in your mind. Okay. Recently, which movie you learned as so watch? Pathan. Excellent. But you should watch movies also sometimes. Sit. So if you watch a movie seriously for 2 hours, after seeing the movie, maybe after 1 week, if somebody asks the story, scene by scene you can narrate. You are not by hearting that, right? You are not by hearting the movie. But after watching the movie, even after 1 week or 1 month also, you can sometimes you can recollect the dialogues also. कितने आदमी थे वो, क्या है वो, कलिया है ना, शोले मूवी पे आता है. So similarly, we can memorize the things even without putting efforts. Even without putting efforts, right? Is it right? Yes. So how it happens? Because it is a pictorial memory which keeps the memory in your body, in your brain. So it is a learning technique. So that is why while learning Ayurveda also you can use some pictorial memories. While learning Ayurveda also we can use the pictorial memory. Create the incidences, create the situations, so that when you learn, so that it will keep you in your memory. I can tell the shloka of Chavanaprash. You are familiar with the Chavanaprash, I think, right? Yes. So I can, it is around a 22 line shloka, Chavanaprash. So I can tell the shloka without any mistakes today also. Because when I learned this shloka, we 3 people were there. We were with some competition mode. We were learning this shloka. Who will finish? Who will fast? So still I can remember at the time when I learned shloka Chavanaprasha in my room, how we were learning. One person was walking other side, I was walking this side, and in between we are trying to reproduce it in front of the other person, so that each and every stanza I can remember. And I can remember the page of the Chavanaprasha which is mentioned in Charaka Samhita also. In the text, which side of the page and which column it comes. So that is the pictorial memory. So that is why when you learn any such kind of thing, any shlokas, use your own textbook. That is very important. Your own writings. That is very important. मेरे पास बुक नहीं है, दे दो थोड़ा. उनका बुक देखा तो कुछ समझ में नहीं आएगा. तो आप खुद का नोट लिखेंगे, आप खुद का टेक्स्ट पढ़ोगे, so that it is easy to locate the references, locate the shlokas, locate the content very easily. So that's a very good habit. If you can have your own books, mark if you want with pencils. So some small notes you can keep it in the shloka, near to the shloka with pencils. So that whenever, maybe in future also. Now also I am having my Charaka Samhita which I was using in my post-graduation. So lot of notes will be there in that. So whatever reference I need, if I forget something, just take my own book. Easily I can, within seconds I can locate the content. In some other same print, same publication, Charaka Samhita, if some other book is there, it may not be possible. For example, if you frequently use some book, sometimes the page may be thicker at that time because of frequent use. It may be little loose, right? After frequent uses, so that it becomes like bookmarks also. So use your own textbooks for learning purpose. Keep some situations, create some situations while learning. And another important thing is chanting. The repeated chanting of shloka. Repeated chanting of shloka, that gives two things. One is the audible memory also it creates. Because when we chant, we will hear also from the others. So audible memory along with the pictorial memory. So similarly in the clinics are such a beautiful place where we can love to learn. Sorry, learn to love. Sorry, love to learn. Right? Okay. So in the clinics, we can see the patients and we can keep it in our memory and reproduce whenever we want. By hearting the sloka in background, give you a previous memory so that you can recollect when the patient comes in front of you and we can reproduce it in front of the patient in the treatment. Okay, these are some of the learning techniques also. So this is a patient of psoriasis. Okay, plague psoriasis. Psoriasis you might have seen in your surroundings also. Not very dangerous disease, but a very difficult to treat condition also if it is all body psoriasis is there. In Ayurveda also it is considered as one of the Bhudosha avastha. The doshas are more vitiated in this nature. So he was a pilot trainee at the US and with a short, at the time of visit in our clinic hospital, this was the condition. I think it is visible, right? Yeah. So plagues for their entire body with a short history of 5 to 6 months. And see the various areas you can see. So this is the timeline. This case is also published in some journal, also reputed journal. So the patient was in US. Some small skin eruption he had once in while he was there. So he approached the family physician. He was first you have to go for the family general practitioner. Then only you can go to the specialist. So they have given some external application. It went off, and after that. It subsided. Maybe after 1 or 2 months, again some another skin lesion came out, and later he approached again. Then he told it may be some tick bite. So some antibiotics was given, and it subsided. Again later after 2 3 months, again it came out. So he went to a dermatologist referred by the general practitioner, and he told it is psoriasis. By that time, the almost entire body was affected with the disease. So because of that, it gives a lot of mental agony also, because the public appearance, the social contacts will be very much restricted for these people. So that's why he went to depression, and he closed himself in the room, and he didn't appear for the training sessions, etc. So his supervisor or the head inquired about this. So he came to his room. So he told, I'm not coming for training and all because I can't face the people, because entire body is affected with these kind of lesions. So his supervisor told, you just take the leave and go back to home. He was from Kerala. So he came to the Kerala at that time and underwent the biopsy checking. So you can see the biopsy mark also. So in the medical college, and from there he directly came to the Ayurvedic hospital. Okay. So this is the condition when he approached us at the hospital. Entire body is affected with the psoriatic lesions, plague psoriasis. Okay. So at the time of admission, the patient was having itching all over the body, severe scaly lesions. Every day he will get this much of scales out of his bed, and disturbance in sleep, less appetite, weakness, and he used to talk some irrelevant things in the sleep also, during the sleep also. Okay, so this is mentioned in the text. I'm not going to detail to that. So, which is mentioned that Bahudosha Lakshana. When the doshas are vitiated excessively, what are all the lakshanas are seen? If these lakshanas are there, we have to go for the purificatory therapies. So in this patient, we can see many of the lakshanas which I mentioned earlier, like itching is there, weakness or indigestion, even dreams, bad dreams, seeing bad dreams, relevant speech during the sleeping hours, etc. So many of them suggestive that the patient is having the Bahudosha Lakshana. So we plan for the Shodhana in this patient. And Shodhana means purification. Another term for the purification is Shodhana. Pancha Shodhana, 5 purificatory procedures. Vamana, Virechana, Basti, Nasya, and Shiro Virechana, and Raktamokshana, we can say some extra. Okay, so Shodhana is indicated, or the purification of the body is indicated in this condition. Okay, so being the psoriasis, which is diagnosed as Kitiba in Ayurveda, so the selection of the purification also depends on the visheshan of the dosha. Selection of the purification is also depends on the dosha visheshan. So they are the basic factors which are responsible for the disease or the health. Doshas, as you know. Okay, or you may be learning in the future classes. So the Shodhana was advised. So for preparation of the Shodhana, we have to pour some Rukshana therapies. That means pouring of decoction to the body. So कषाय धारा बोलते हैं इसको. काढ़ा बनाते हैं, काढ़ा से बॉडी को धारा करना, pour all over the body for 30 minutes or 40 minutes. ऐसा 3-5 दिन के लिए करना है, so that body में रूक्षण ड्राइनेस हो जाएगा, digestion improve हो जाएगा, then we will start the ghee, drinking of the ghee, sneha. So we omit all those aspects. Shodhana was done, that means Vamana was performed and Virechana was performed. 2 Shodhana, 2 purification methods was adopted. No modern medication, no steroids, no methotrexate, nothing. So this was the condition after 28 days of therapy. 28 days of hospitalization. Only with the purificatory therapies, inducing therapeutic vomiting, and after that, a course of inducing purgation. See, what is the change? So, very significant change from the entire body plaque. Previously, it was like that, and later, the skin become almost normal. Okay, so after the vamana, after the therapeutic vomiting itself, there are a lot of changes. Itching reduced, scaling also reduced by the next day morning. Same day evening, itching reduced. Next day morning, scaling reduced. On the day of vamana, at the night, there was no irrelevant speech during the sleep hours. He was comfortably slept. And after that, there will be again the second course of Shodhana, that is Virechana, was performed. So these photographs are taken after the 28 days of 2 course of Shodhana, Vamana and Virechana. See, here you can see some of the areas where thick skin is there, there will be some small lesions still was there even after the 28. But almost all the skin become normal. Okay. So again, after that, some unique practice of rasayana medication is also there. This is one of the medicine like Chanaprash in paste consistency. Manibhadra Gula rasayana. So Manibhadra Gula or Manibhadra Avalek. So it is the consistency of the Chanaprash, as you know. So this is mainly indicated in the skin disease. This medicine was prepared by the students themselves and administered to the patient for a month. So it is also a nature of mild purgative in nature. So if you take the Manibhadra Gula in morning 1 hour, 1 spoon, you will get the loose motion 2 to 3 times. Okay, so like that 1 month medicine should be given. So total after the admission, after 2 months, 2 months of admission, you can see the changes. How's it? The skin become completely normal. So total 2 months of medication. Because the photographs are the pixel is high resolution pictures, that's why it's taking time. Only you can see some marks are there, but it is not the lesions. The discoloration were there, and Okay, so this is the timeline of the thing, and it is published also. So this is the another one. Okay, so this patient, after the 2 months of therapy, we suggested him to go back to the home. And again, he stayed in the country for another 1 month. After the 3 months course of therapy, he went back to US. Now he completed his training and he is a licensed pilot now. This was happened in 2017-18. So now it is 23. Still he is under follow, not on medication. He is under follow, not on medication, with proper lifestyle modifications. So no relapse of the condition is there. Regularly we are monitoring dermatological life quality index. There are many things are there to assess the improvement of the therapy. So all those parameters were checked, and till today, even after the 4 years or 5 years of gap, the patient is under good control. Okay, so this is happens because of the proper administration of the Ayurveda. There is no magical remedies in this. There is no wonders in this. This is the strength of Ayurveda. This is the strength of Panchkarma therapies. Okay, so many people say that uh, it is a special yoga I have given, some secret yoga I have given from a transferred my grandfather, उसका grandfather से आया है, ये थोड़ा secret है. ऐसा कुछ भी नहीं है आयुर्वेद में. Ayurveda, there is no secrets in Ayurveda. Only the people keep it as secret. They don't want to share. ऐसा कुछ भी नहीं है. Everything is written in the text. Only thing, you love your textbook samhitas, learn from them and interact with the teachers, clear up your doubts so that you can also become a good practitioner. Okay, ऐसा कुछ भी नहीं है. टेक्स्ट में कुछ बताया है, हम दूसरा कर रहा है. कोई प्रैक्टिशनर ऐसे भी बताए, हम टेक्स्ट में ऐसा लिखा है पर अभी थोड़ा हम अलग कर रहे हैं. टेक्स्ट में जो जिससे अलग है, ऐसा कुछ भी नहीं है. टेक्स्ट में जो बताया है, even in this era, even this time point, it is very much relevant. Same practice karo, you will get success. ठीक है? So this is another case. This is also very interesting. Generally, the vesiculobullous diseases, they are considered as autoimmune. Even the psoriasis is also considered as autoimmune disorder. Okay. Vesiculobullous means blister kind of thing over the skin, eruptions seen in the form of blisters. blister पता है blister बोले तो जब जल जाता है, फोड़े फुंसी है ना, हाँ ऐसा. Water fill the elevations over the skin. So bullae will be formed in the skin. Okay, some of them is contagious in nature, some are related with the viral thing, and some are infectious also. So this was a condition, vesiculobullous condition. In Ayurveda, it is considered as the Vispota Kushta. The terminology or nomenclature may be different, but the concepts are same. Okay, the patient, she was a teacher and came to the clinic, so having the bullae on the legs. See, you can see the blister over the foot. Okay, this was the second visit. Okay, previously she was taking the medications from the local dermatologist, had some antibiotics and also steroid therapy also. At the time of administration, it subsides, but again, maybe within a week, it relapse comes again. That was the condition. So at the time of admission, at the time of consultation, she had the blisters over these areas also. All these. Okay. All these were present at the time of first consultation, but we forgot to take the photograph at that time. Okay, so suggested some external therapies, no admission. External therapies to do in home itself, application of some medications over the lesions and some internal medications to purify the doshas and also to purify the blood. So this was the condition when she approached for the second visit after 15 days of medication. Okay, so some of the blisters were break open and some still was. So this is the timeline, how the things were started and what was the therapies and etc. This is also published. You can, if you are interested, you can learn and read that papers. So after that, the patient was undergone for the Shodhana, Panchkarma therapy. Virecchana was performed, Shayadhara Virecchana was performed to that patient, and this was the condition after the Virecchana. The entire area became clean. The hands, slight marks were there only because of the skin peeling, but after 1 week, again the skin become normal. Okay. So similarly, another interesting case is there, the keratosis pilaris. So another skin disease where the uh, skin eruptions in the form of pimple kind of eruptions will be seen in the body, especially in the dorsal aspect of the shoulder and upper arm, both hands generally, and upper chest it will come. Okay. So why I am showing these skin uh, conditions or skin cases only, because it is easy to communicate with photographs. If I treated an infertility case, I cannot present in front of you the outcome before after. Okay, so this is because before treatment how it was, after treatment you can visualize, you can personally see how the changes is happening. That's why I'm giving only skin diseases. There are many other conditions, even neurodegenerative conditions are there, even the psychiatric conditions. Presently one patient is there in our hospital. He was an engineering student also. He was engineering was in the first year when he joined engineering, he got severe ragging in the institute. Here ragging is there. Very good. So he got a severe ragging in the institute by seniors, and after that he went to depression. Okay, now he is severely depressive in nature, and some suicidal tendency is also there. Looked after by a single mother because his father also expired a few years back, and his brother is also there. He is also working. Okay. And this mother struggles a lot. Sometimes he beats the mother also in the home. So they came to the hospital and given some medication, internal medication, some ghee preparations, but there was no much improvement. So last 20 days back, he got admitted, and we started the uh, preparation for the Vamana, therapeutic vomiting. So Snehapana was given. During this Snehapana, he ate his own fecal matter in the bathroom. So that much of severe depression was there. Okay. So he tried to drink his urine. These kind of activities are there. So in Ayurveda, we consider it as under the Unmada. Okay. So Sheela Vibhrama is routine activities, deviating from the routine day-to-day activities or routine characteristics. All these are seen in this patient. So Snehapana was given. It was very difficult to give Snehapana. Snehapana means the medicated ghee will be given to drink. Medicated ghee will be given to drink. Generally, the medicated ghees are not very much palatable, very difficult to drink also. So in normal people itself will hesitate to drink, but initial 2 days he drank without any complaints. Third day, every day the dose will be increasing also. On the third day, when the dose was around 180 ml, he refused, and so we forced him to drink. Okay, so forcing in the sense, he will generally, these people will not open the mouth when we give the ghee to the patient. वो क्या करेगा, ऐसा बैठेगा क्लोज करके स्ट्रांगली. तो कैसा पिलाएंगे इसको, पिलाए तो ही हम नेक्स्ट वमन कराएंगे, वमन कराए तो ही कुछ रिजल्ट मिलेगा. तो विद द कंसेंट ऑफ द मदर वी फोर्स हिम. उसको क्या किया, साइड से स्पून डाला तो मुंह खोला तो फिल किया घी. तो ऐसा उस दिन भी घी पिलाया. So it generally the Snehapana, the drinking of ghee takes around maximum 10 minutes. कोई भी है तो थोड़ा थोड़ा मुश्किल से पीते हैं, 10 मिनट में खत्म हो जाए। इसको एवरीडे 1.5 आवर इसको घी पिलाने में इतना मुश्किल से हमारा पीजी स्कॉलर्स या पीएचडी स्कॉलर जाके उसको पिलाते हैं। तो अराउंड 5 days स्नेहपान ऐसा किया, एंड आफ्टर दैट 1 day रेस्ट विल बी देयर बिफोर वमना। उस दिन कुछ उसका खाना सभी दे देंगे, बट ड्यूरिंग द व्हेन द dose reached on the last day, he became little normal. During the snehapana he was abnormal, but on the last day of snehapana he touched the feet of his mother and asked sorry. Some changes observed like that. And next, after 2 days, Vamana was performed. So generally, Vamana takes 1 to 1.5 hours. If you start at 7 o'clock in the morning, generally done in the early morning. So if you start at 7 o'clock in the morning, it will finish by 8:30, maximum by 9. Okay. So for this patient, I was also there. We started at 6:30 in the morning, and it went up to 11 o'clock because he was not ready to drink the milk, whatever medicines given during the Vamana, he was refusing to do that. But with forcing him, same method, putting the spoon and closing the nostril so that automatically mouth will be open, right? So we, at last, around 3 to 4 times we make him vomit. Okay. So during that process of Vamana, he shouted also. So some behavioral, this will be there, getting agitated, etc. But we performed the Vamana, and yesterday when I left the institute morning, I went to see him. So I asked, how are you, Abhinav? His name is Abhinav. How are you, Abhinav? When you want to go home? He told, no, I want to complete the treatment. This was his answer. So it is surprising. It is a way, that is the strength of Ayurveda. And he was started interacting with the our scholars, PG scholars, even with mother also. He started to behave very gently also. Okay, not completely cured, but there is a positive change. So when they came to Ayurveda, before that they have tried all the modern medical system, all the therapies in the modern psychiatry and all. They fed up with that, then only they came to Ayurveda. So if we can see the smile in the face of his mother, it's a big thing, right? So that is why Ayurveda Acharya says that Kochit Dharma, Kochit Dhartaha, Kochit Maitri, Karmabhyaseti Kochit Cheti, Chikitsa Nasti Nishphala. So when we treat a patient, always there will be some fruitful outcome will be there. It may be in the form of dharma, as our charity or behavior. It may be in the form of some monetary benefit. It may be in the form of some relationship, friendship relationship. Or if kuch bhi nahi aaya ye teenon mein, you will get the experience. You will get the skill. You can develop the skill. That is the benefit of the Chikitsa Shastra. That is the benefit of the Chikitsa Shastra. So all of you are blessed one, so that because you chose the system of Ayurveda, a noble profession. Becoming a Vaidya or a practitioner of medicine or becoming a physician is not a simple thing. Lot of devotion is required. Lot of compassionate behavior, approach to the patient is required. Humanity is required, right? So it is not a mechanical thing what you see in the modern medical system. तो आँख आया, आँख देखा, मेडिसिन लिखा, जाओ. आदमी नहीं चाहिए, only आँख चाहिए. Hepatologist will see only liver, not the person. Ayurveda ऐसा नहीं है. We see the person. So that is why all the Sanatana Shastras, all the Shastras which is developed out of Sanatana Dharma, having that compassionate nature. So that is why Ayurveda says, Anadhan Rogano Yascha Putravat Samupachare. If the patient is abandoned by anybody else, it is the responsibility of the Vaidya to look after him like his own son. पेशेंट को कोई नहीं है, उसके पास पैसा नहीं है, ऐसा है तो इट इज becomes the responsibility of the vaidya to treat him as his own child. Okay, so these things you will learn in your uh, first year when you learn the samhita related things also. So again, there is some subhashitas from the Ayurveda. It says that we have to atmavat satatam pashet kita pipiligadati. We have to treat others as our own self. Even the small creatures in the world, like ant or the insects, whatever it may be, कीट पिपीलिकादपि, उनको भी हमें हमारा जैसे ही ट्रीट करना है. This is the noble thought process behind Ayurveda. Noble thought process behind Ayurveda. So like that, lot of good quotations you can see, you can find out from Ayurveda, which should not remain as a quotation in the text. We should try to imbibe in your character, in your day-to-day practice, try to impart this knowledge to the society also. Okay, so this is a keratosis pilaris patient where the skin diseases we can see. See, small eruptions over the chest, and also on the mainly the keratosis pilaris is seen on the lateral dorsal aspect of the upper arm. This is the common thing. It is not a troublesome disease. Many of you may be also having, but generally it is a non-problematic condition. So sometimes what happens is the disease eruptions may become infected and swollen also. Then it may be becoming painful and causing some itching, some sort of secretions out of that. This was a condition where the patient has infected eruptions and with itching and mild pain. Okay. For him also, we have done the 2 course of Shodhana therapy. When initially Vamana was performed, and after that again a course of Virechana was also performed. Okay. So in different intervals. This is after treatment 1. There was the reduction of the size of the eruptions, and after the treatment 2, almost the eruptions were disappeared. Only some discoloration was removed. Okay. See, the practice of Ayurveda, as I mentioned, it is a very noble profession, and we need a lot of devotion towards Ayurvedic science. Not only Ayurvedic science, if you want to become a good physician or a doctor, you should understand the people's agony, right? So for that, you should be a good listener. You should listen what they are telling and analyze what their problems. Accordingly, we have to recollect what is mentioned in the text, then try to imply or apply them on the patients. Okay, so Kitiba or the erythrodermic psoriasis. This is the another psoriatic condition, very difficult to treat. Reddish eruptions all over the body. Generally, with Ayurveda medicines also, it is very difficult. In modern medicine also, it is very difficult to treat. It is one of the very difficult to treat conditions. So the patient approached in the OPD. He was given some internal medications generally. Maybe he was for internal medications around 2 to 3 months, but there was no much changes. So you can see the reddish patches. The specialty of these kind of skin lesions, they will be along with the burning sensation. Apart from the itching, it will be associated with the burning sensation also. So when the itching along with burning, it is much troublesome to the patient. Okay, so this was before treatment patient photograph. The entire body, the thighs and and back, all body. There was no area which is not affected with these skin lesions. Okay. So during this period, we have performed Vamana also and Virechana also was performed. So after the every day, he will stay in the hospital along with his mother, because I can recollect these situations because, as I mentioned, it is a pictorial memory. Okay, so when I enter every day for the rounds, his mother used to stand at the sides of the bed and he used to cry every day. And every day she will ask whether it will reduce or not. क्या ये कम होगा या डॉक्टर साहब ऐसा ही पूछते थे. तो हाउ वी कैन रिप्ले पेशेंट के आगे हम नहीं बता सकते, ये बहुत डिफिकल्ट है, ये कम होना का चांसेस कम है, ये तो कुछ भी नहीं है, कम होगा बोल के ही आना पड़ता है, राइट. So this was the situation. So patient used to have burning sensation every day and itching also. So we performed Vamana and Virechana for around 20 to 25 days it took. And after the Virechana, one day when I went to see him on the evening, so he told now it is getting reduced, sir. Burning sensation is reduced, itching also reduced. And he was happy. His mother was smiling on that day. Next day, again, morning, I went to see him. Next day, no, after 2 days, because after the Virechana, there was some dietary restrictions for advice. After that, again, he started to take the normal diet. On that day, to plan for the further treatment process, I went to see him. In the morning, when I went, his mother was crying again. I asked him, क्या हो गया? नहीं सर, उनको अभी बढ़ गया सडनली कल रात से. क्या किया बढ़ने के लिए? कुछ नहीं किया, मेडिसिन शुरू नहीं किया, only on dietary restriction he is there, because on that day morning I was planning to read the further course of medication. नहीं सर, सडनली इंक्रीज हो गया, रेडिशनेस वापस आ गया, itching सडनली इंक्रीज हो गया. So I was in my general rounds of the hospital, so I told I will come later. And I went to see the other patients. After finishing the rounds, again I came to this patient and sat with him, took a paper, and I asked him to tell whatever things he has done on the day one, previous day. So I noted down one by one, point 1, 2, 3, like that. What activities he has performed, what medication he has taken, what food he has taken, like that. So नहीं सर, जो आपने सजेस्ट किया वही मेरे खाना हमने लिया है, कोई प्रॉब्लम नहीं है. क्या मैं फिर भी पूछा क्या क्या लिया है बताओ, टेल मी, क्या क्या लिया है आपने सुबह से लेके शाम तक, क्या क्या खाना लिया, कितना टाइम पानी पिया, कितना टाइम टॉयलेट गया, कोई आने के लिए मिलने के लिए आया था क्या, एवरीथिंग आई नोटेड डाउन. एंड ओनली one change I was found was on the previous day he took the watermelons. Generally, watermelons are not troublesome in this kind of skin diseases. I used to advise them, you can take watermelon. But apart from his normal routine food in the previous day, he has taken watermelon on that day. That was the only thing I can find. So later I read about watermelons. There are a lot of malpractices in the marketing of watermelon is happening. Chemopoietic injections were given to watermelons sometimes to get the good color, reddish color of the watermelons. Sometimes it may be aggravated the conditions. Okay, so anyway, again we have to treat. We have again planned for Virechana. The second time Virechana was performed, Virechan किया, Virechan करने के बाद he become normal. Okay, and again after a period of 3 months, again one course of Shodhana, that is Virechana, was given. This is after that. Okay, this case is also published. So why I am telling it is published, because it's not claims. ऐसे ही हम आपको entertain करने के लिए नहीं बता रहा, ऐसा किया है, वो किया है, ऐसा नहीं. All these are systematically, scientifically recorded cases which is published and available in the public domain. हम publish किया है, इसको बाकी लोगों को पढ़ने के लिए, और इट कैन बी यूटिलाइज्ड फॉर द साइंटिफिक कम्युनिटी. ओके. Vichachika is another skin condition. I think up to 12 again. And after last 15 minutes, we'll keep some question answer session. If you have any queries, we can ask also. Okay. So this is the another condition where the patient had the entire body skin kind of dermatitis. नहीं चेंज हो रहा है. हाँ. साइज बड़ा है. This is after treatment. So generally in this the Panchkarma procedures are being done. Either Vamana, the therapeutic inducing of vomiting, or therapeutic purgation will be done. So here the patient has undergone for the Virechana, that is the therapeutic purgation. Vipadika. This is a simple but very much troublesome condition, right? Many of your family members may be having. Mataji ko hoga, Pitaji ko hoga. Sometimes you also may be having this. ये इतना बड़ा स्किन एलिमेंट्स नहीं है, बट इट इज कॉस्मेटिक वैल्यू, इट्स ऑन कॉस्मेटिक वैल्यू, है ना. So cracks in the foot. So generally simple cracks can be easily treated with the proper hygienic measures. पैर को ठीक से वॉश करके, क्लीन करके, रब करके रखा तो वो क्लीन हो जाएगा. But when it is in the advanced stage and the cracks appear in the entire foot, you can see some deep deviations. So plantar psoriasis, some of them are comes under the classification of plantar psoriasis also. So ऐसा conditions में generally उसको clean करना है पहले. So we have to clean the personal hygiene is very important in treating these conditions. Okay. तो इसके लिए simply इसको clean करना है, गर्म पानी या नमक का पानी से अच्छे से wash करना है, and we can remove the skin of scalpel or the blades, sterile blade. Then after that, the application of Pada Nimajjana. It is a unique procedure which is proposed by us. Pada Nimajjana is dipping of the affected part in the oil. So generally, a simple remedy was used. It was a PG study also, postgraduate study, research study was taken place in this also. तो इसके लिए इसका महिषाग्रता को क्या बोले हिंदी में? महिषाग्रता. हाँ, भैंस का घी. हाँ, भैंस का घी यूज करना, सिंपल. महिष भैंस है ना, भैंस का घी मिलता है ना, उसको थोड़ा वार्म करना है, लिक्विड जैसा बनाना है. आफ्टर वॉशिंग विद द सॉल्ट वाटर और lukewarm salt water, keep the area dry, then dip in the महिषाग्रता. भैंस का घी में डिप करके रखना 15 to 20 minutes एवरी डे. आपको इसको 7 दिन से 15 दिन करना है, ठीक हो जाए. हाँ, lukewarm, कुछ नहीं, सिंपल. Okay, this was a study, postgraduate study. It is published also. You can see. And if at all, sometimes AC conditions may be 7 days, 15 days के बाद photograph, but they have to maintain the time so that it will become the normal. Okay. Sometimes what happens is these conditions will be associated with the itching, and sometimes bleeding also may be in some advanced conditions. Yes, we need to give some internal medications also and some the medicines also for the Pada Nimajjana, dipping in oil. That medications also we need to change, like Pindathaila, Jada, Jivandyadi, Omega, etc. There are many other medications also. Okay. So Kuti Praveshik. So Kayakalpa, you might have heard the word Kayakalpa. Kayakalpa सुना है? हैं? सुना है? क्या है कायाकल्प? हैं? कायाकल्प बोले तो क्या है? हैं? बॉडी स्ट्रेंथन करना, स्ट्रक्चर. हाँ हाँ बताओ. हाँ कायाकल्प. वेरी गुड बेटा. और कोई? Anybody else having any idea? Kayakalp के बारे में? Okay. Kayakalpa is a practice which is was prevailing in Ayurveda. A distinct way of administering rasayana medication. Rasayana is the medicines which is given in a structured manner in large quantity for strengthening the body in various aspects. Maybe strengthening the various tissues in the body. We can say. Okay. In general, this is a way to understand. सो उसका एक स्ट्रक्चर्ड मेथड होता है, उसको कायकल्प, नहीं तो कुटी प्रावेशिका रसायन बोलते हैं. कुटी प्रावेशिका, इसमें क्या है कि एक कुटी, कुटी बोले तो एक बिल्डिंग रहता है, 3 लेयर्स होता है उसके लिए. एक लेयर आउटर लेयर होता है एंड इनर लेयर होता है, उसके बीच में एक दूसरा लेयर होता है ना. अब खाना क्या खाया, ब्रेकफास्ट क्या किया? हाँ आलू परोठा. इसीलिए बताओ, आलू परोठा मत खाओ सुबह सुबह है, ठीक है. तो इसका कुटी बोलते हैं. कुटी बोले तो बिल्डिंग, सम स्ट्रक्चर्ड बिल्डिंग कुटी बोलते हैं ना. 3 लेयर होता है इसके अंदर. उसके अंदर रह के हमें अराउंड 41 डेज मेडिसिन लेना है विदाउट एनी कॉन्टैक्ट टू द एक्सटर्नल. इसको कायकल्प बोलते हैं, कुटी प्रावेशिक रसायन. इन सुश्रुत संहिता सोमराजी बोल के एक हर्ब है, उसको एक प्लांट है, उसको इसके अंदर रह के खाना है. उस पे क्या क्या होता है बोल के बताया. सो यू विल लूज योर स्किन, you will lose the fat from the body, only the veins and bones will be remaining, and after a certain period again there will be regeneration of these things happen, so that old person also will become young. ऐसा एक प्रैक्टिस, इसको कुटी प्रावेशिक रसायन. देयर इज सम डॉक्यूमेंटेड life of some yogis also there, scientifically documented. The yogi who lived for 300 years. It's the story of some yogi who was lived in the Himalayas. Okay, ऐसा book available है, you can read that also. उस पे क्या बताया है कि the yogi was he was the Raja of Gwalior. No, not Gwalior, Patiala. He was the Raja of Patiala, one gigantic figure, 6 feet height and very big person. So वो बीच में क्या हो गया, उनको विरक्ति हो गया लाइफ में, पूरा छोड़ के सन्यासी बन गए. एंड ही वेंट टू हिमालयास. उसके बाद किसी ने उसके बारे में नहीं सुना. तो इट वाज एट द टाइम ऑफ ब्रिटिश रूल. सो राजा उस पर थे, वो सभी डॉक्यूमेंटेड है. राजा कितना साल पे वो सिंहासन लिया, रूलिंग कब शुरू किया, वो सभी डॉक्यूमेंटेड है. कब छोड़ के गया वो भी है, पर उसके बाद क्या कहा गया किसी को पता नहीं है. ही वेंट ऑन मेडिटेशन इन हिमालय, ऐसा बिलीव करते हैं. सो लेटर मे बी आफ्टर मेनी years in the court of Patiala one case came. एक डिस्प्यूट आ गया. वो राज परिवार का जो इसका क्या बोलो, इसका है, हाँ उसका जो लैंड है, घर है, उसका डिवाइड करने के बारे में कुछ डिस्प्यूट आ गया. तो उसके लिए एक पॉइंट में प्रॉपर आंसर नहीं मिल रहा था कोर्ट को. उसको कैसे डिवाइड करें, क्या किसको जाएगी, कौन सा एरिया है, ये सब. So at that point of time, this person came to the court. This person came to the court and appeared in front of the court, and it was recorded in the court proceedings also. So this was happened after 200 years of his disappearing from the Patiala. तो 200 years के बाद वो फिर उधर reappear हो गया. So this was recorded, documented, and later, based on his life, this book was written. उस पे वो बता रहे हैं, हम ऐसा एक योगी के पास गया हिमालय में, उन्होंने मुझे एक गुहा में रखा, उधर ये किया वो किया, मेरा ऐसा ऐसा चेंजेस हो गया, जो सोशल संविदा में हम देख सकते हैं. सिमिलर एक्सपीरियंस ही मेंशन्स इन दैट बुक आल्सो. Okay, so this is called Kaya Kalpa. Later, this was practiced in the time of Madan Mohan Malviya ji. Have you heard of Madan Mohan Malviya? Yes. Who is that? Founder of BHU. Very good. BHU. उनको BHU के लिए जगह पूछा राजा से, मदन मोहन मालवीय जी. तो राजा बोला आप जितना चाहिए उतना ले. वो कैसे लेंगे जितना चाहिए बोले तो. नहीं, आप एक दिन में कितना जा सकते हैं उतना जगह ले. ये भागने लगा, सुबह से लेके शाम तक भागा, रनिंग, लिटरली रन. तो जितना कवर हो गया उतना एरिया पूरा बीएचयू के लिए मिला. ऐसा स्टोरी है. पर ही वाज ए वेरी गुड स्कॉलर आल्सो, मदन मोहन मालवीय जी. उनके लिए भी कुटी प्रावेशिक रसायन का एक प्रैक्टिस किया था. वो एक साधु ने किया था. ही वाज फ्रॉम माउंट अबू है. उन्होंने इनको कुटी प्रावेशिक रसायन. लेटर हमारा एक प्रेसिडेंट था वीवी गिरी, उनको भी कुटी प्रावेशिक रसायन किया केरल में. ओके, सो ऐसा कुटी केरल में भी है अभी. पालघाट में डॉक्टर सेतु माधव, he is having such a कुटी also. ओके, तो वो इतना फ्रीक्वेंटली नहीं करता है, कमर्शियली नहीं करता है. तो he is a very special doctor also. तो उनको मन में आया तो ही करे, मुझे उनको लगना है या इनको करना है, नहीं तो वो मना करते नहीं करो, जाओ. ऐसा है. तो वो अभी करता है. So this was a trial which is done by myself for a patient. Okay, it was not a actual kuti praveshika rasa, but I kept the patient 15 days in the closed environment. Closed environment. Again, it was a case of psoriasis patient. He was my first patient, if you see, of psoriasis. I treated very seriously. So a young boy at that time, he was around 20 years, and his father was in some accounts general office at Kerala. So उनका क्या है कि so previous at that time I was not aware to record because it was in my initial time of practice. So before treatment photograph, this thick skin, it was lighter. Completely black skin lesion, like the skin of elephant, like the skin of elephant, thick black skin. You can see. Okay. So उसने फर्स्ट आ गया तो उसको क्या प्रॉब्लम था, स्वेटिंग नहीं आ रहा और पूरा स्किन ब्लैक हो, उतना ही प्रॉब्लम. थिक स्किन लीशन, इचिंग नहीं है, स्वेटिंग बिल्कुल नहीं आएगा, पर दिखने में पूरा काला होगा. तो मुझे उसका वैलेट से फोटो दिखा रहा था, देखिए आपका जैसा स्किन था मेरा भी, तो अभी पूरा ब्लैक, वो ही देखता रहता था फोटो. तो 20 ईयर ऑफ एज, वो स्टडीज सभी बंद किया, कॉलेज जाने में मन नहीं लगता है. क्लासमेट्स उनको पूछेगा ना कि ये सब क्या हो गया, ये सब. तो फेसिंग द सोसाइटी बिकम गेट डिफिकल्ट. सेकंड, तो उसका पिताजी लेके आ रहे थे, तो पिताजी लेके आए, बताया. तो मैं बोला उनको स्वेदन दे देंगे. स्वेदन नहीं आ रहा है ना, स्वेदन बोले तो स्टीम थेरेपी, स्टीम दे देंगे. तो फर्स्ट डे स्टीम दिया, कुछ नहीं हुआ. सेकंड डे दिया, कुछ नहीं हुआ. थर्ड डे उनको स्वेदन शुरू हो गया, उनका खुद का स्वेटिंग शुरू हो गया. तो स्किन बिकम्स लिटिल लाइटर. स्किन नहीं तो टाइट था, थिक स्किन था ना, तो टाइट हो रहा था. तो उसके बाद थोड़ा लाइटर स्किन हो गया. देन आफ्टर दैट अराउंड 6 years I treated him in different intervals. I performed Vamana, Vivechana repeatedly in different intervals. Every time his father will take leave from his office, he used to come and stay and with the person, with his son, and perform the procedures. ऐसा था. So Vaman Karna, Vidhi Chandra, so he was very close to me at that time because every time I used to see him, I used to counsel him, I used to talk about Ayurveda. So he tried to learn Ayurveda also. Once I told about Kuti Praveshikar Sahib also. So he told me, sir, I am ready. Whatever you do, I am ready. Because after certain period, the patients will have such an amount of confidence on the Vaidya. Whatever we tell, they will obey because they think us as God. That is the specialty of this profession. So we should be elevated to that stage mentally also. हम पूरा गंदे हरकतें करें और पेशेंट हमें आप भगवान है बोले तो अच्छा नहीं लगेगा ना. तो वी शुड ऑल्सो फॉलो सर्टेन लाइफ स्टाइल टू बी ऑन दैट स्टेज. ठीक है. तो ये जैसे बताया हम रेडी है. तो उसका फैमिली भी बहुत प्रॉब्लम था. तो वो फादर बोलते थे मदर इज हैविंग सम मेंटल प्रॉब्लम. तो इसका एक छोटा भाई है, ही वाज वेरी गुड, ही वाज वर्किंग, कंप्लीटेड हिज स्टडीज एंड वर्किंग आल्सो. सो इसका मदर इसको गालियां देता था, क्यों ऐसा जी रहा है, मर जाना, इतना गंदा इस पे क्यों जी रहा है. मदर का मेंटल प्रॉब्लम है इसलिए वो बोलते. और इससे ये फिर डिस्टर्ब हो जाता है. ये कराटे ब्लैक बेल्ट. तो वो क्या करता था, दरवाजा तोड़ता है गुस्से में, नहीं तो इरिटेशन हो गया तो घर पे जो बेड है ना, कॉट, वो सभी तोड़ता है, पूरा टूटा फूटा है. वो बोल के उसका पिताजी रोते थे, पर पिताजी उसको सपोर्ट करता था, लेके आते थे रेगुलर. So every time there will be some or other changes you can observe. That's why every time they will come out. So उसके बाद last I thought that I will go for some rasayana therapy, Kuti Praveshikar Rasayana. So I converted one room in the hospital, closing all the windows. उसको ग्लास में सभी पेपर चिपकाया और एक 0 वाट बल्ब काली डाला. ठीक है. वेंटिलेशन का छोटा होल से लाइट आया. सो नॉर्मल, नो फैन, नो लाइट, नथिंग. So morning every day I will visit to him and he was, उसके पहले डेली उसको कस्टम करने के देर में लगा, तो उसको कस्टम करने के लिए डेली उसको आधा घंटे 1 घंटे ड्यूरिंग द प्रीवियस प्रोसीजर उसको ऐसे ही हम ट्रेन करते रहे. उसको स्ट्रॉन्ग विल पावर था इसीलिए वो उस पे रह पाए. तो 15 डेज उसको अंदर रखा. एवरी डे मॉर्निंग में जाता था, उसको मेडिसिन दे के उसको सुबह मेडिसिन खिला के वापस आ जाओ. उसके बाद जब उनको भूख लगता है उस टाइम पे उसको खाना खिलाना था. मेरा एक स्टूडेंट था, वो उस टाइम पे हाउस सर्जनसी कर रहा था, उसको अंदर जाने का. ओनली 2 people used to meet him a day. सुबह में मिलता था, आफ्टरनून whenever food is required he used to. तो डोर क्लोज करके वो टॉयलेट में जाएगा, हम ओपन करके फिर अंदर से बंद किया था, फिर वापस आएगा. तो डायरेक्ट एक्सपोजर टू लाइट आल्सो रेस्ट्रिक्ट. So he used to write his experience. I given him a bunch of papers and pen. जब लाइट है लिखो, आपका मन में क्या क्या है लिखो, ट्रीटमेंट के बारे में लिखो, एक्सपीरियंस के बारे में लिखो, इसके बारे में. So ये कम brought around 20-25 pages of sheets. So, उसका ड्यूरिंग द डिसीज कोर्स उनको पूरा बॉडी गैस बॉक्स हो गया था बिकॉज ऑफ थिक स्किन. एंड 15 डेज के बाद उसको स्लोली विड्रॉ किया रूम से, थोड़ा थोड़ा लाइट को एक्सपोजर किया एंड आफ्टर दैट ठीक किया. तो उसका एक्सपीरियंस में वो लिखा था, आफ्टर 10 days of therapy slowly body hair started to reappear. उनका बॉडी almost skin, upper body becomes almost normal color. This was the medicine given. Almost upper body became normal. ठीक है. उसके बाद नीचे भी thickness कम हो गया, पर discoloration was still it was there. It was very tough. Body hairs started to appear also. So this was around 2009 or 10. Still he is not having any problem. So ये कुटी प्रावेशिक के लिए एडमिट किया, तब उसका पिताजी बोला, सर मैं फर्स्ट टाइम मैं उनको छोड़ के जा रहा हूँ, एनीवे आई कांट स्टे विथ हिम इनसाइड द रूम. मैं अभी जा रहा हूँ, मुझे घर पेंटिंग करना है. आफ्टर 15 years आई एम पेंटिंग माई होम, रिनोवेटिंग माई होम. because he is getting better, इसीलिए और रोने लगे. These situations are very much touching, which can happen in a clinician's life only, right? So उसके बाद उन्होंने चला गया. Then he completed his course also. Now he is a certified taekwondo trainer. taekwondo है ना, उसका ट्रेनर. ठीक है. तो नो मेडिकेशंस, वो खुद लाइफस्टाइल मॉडिफाई किया, इतना साल ट्रीट किया है ना, उसको पता है कभी कभी वो विदेश लेगा. ओके, I think we will stop here. If you have some queries, you can ask. These are some of the conditions before treatment, after treatment. Okay. So to conclude, Dadi Man, the strong man is there, you people are there, and entire world is there. The knowledge which is imparted from our older generations, Ayurveda AIIA, so the collected knowledge, the knowledge which is collected from every person, patient से होगा, नहीं तो कुछ ये काम करने वाले से होगा, तो फॉरेस्ट में जो घूमता है उनसे होगा. The knowledge which is collected from everywhere and उसको structured way में लिखा है. That is I. अभी तो लोग बात कर रहे हैं बिग डाटा. बिग डाटा सुना है? आपका आयुर्वेद ज्वाइन किया तो आपका पुराना फिजिक्स, केमिस्ट्री, मैथमेटिक्स छोड़ना नहीं है. You take along with that. हमारा टाइम पे ऐसा था, आयुर्वेद ज्वाइन किया, पूरा हम छोड़ दिया, फिजिक्स छोड़ दिया, केमिस्ट्री छोड़ दिया, फिर आयुर्वेद पढ़ने. ऐसा नहीं, उसको भी चाहिए. Now I am learning about the modern technology. I am thinking about the biotechnology. I am reading about the artificial intelligence. ये सभी हमें चाहिए. आयुर्वेद में आगे बढ़ाने के लिए we should know the current sciences also. तो आप ये छोड़ दिया तो फिर बाद में after 5 years दिक्कत होगी. तो learn in that way. Look into Ayurveda with the perspective of chemistry. Look into Ayurveda with the perspective of physics. There are lot of mathematical applications in Ayurveda. तो अलग नहीं है ये सब, हमें उसके दृष्टि से देखना है, पर आयुर्वेद का आयुर्वेद जैसा ही मानना है. Okay. So whatever knowledge we gained from our ancient acharyas or maybe the दादी माँ नानी माँ का जो मेडिसिन ऐसे बताते हैं ना, घर पे कुछ हो गया तो दादी है तो वो बताती है ऐसा थोड़ा मिर्च डाल के पानी बॉईल करके दूध डाल के पियो, थोड़ा खांसी कम हो जाएगा, ये सभी बताते हैं. So that knowledge they had, they know. Whatever we use the food articles in Indian cuisines, like turmeric होगा, हींग होगा, लवंग होगा, all are having Ayurvedic values, है ना? ये सभी मेडिसिन जैसा भी यूज करते थे. ऐसा एक नॉलेज को हमें स्ट्रेंथन करना है, and it is very strong philosophical. Ayurveda का benefit वही है. It is having very strong philosophical background. तो जब ये सूरज नहीं तो चांद नहीं तो विंड जब तक इस यूनिवर्स में रहेगा, उतना टाइम तक आयुर्वेद का सिद्धांत प्रिंसिपल्स विल बी. क्यों? बिकॉज द प्रिंसिपल्स और द थियरीज व्हिच इज ओरिजिनेटेड इन आयुर्वेदा बेस्ड ऑन दीस थिंग्स ओनली. उसको लोक पुरुष साम्यवाद बोलते हैं. जैसा एक्सटर्नल वर्ल्ड है वैसे ही हमारा लाइक मैक्रोसॉफ्ट, राइट? देयर इज नो डिफरेंस. सूरज जैसा बॉडी में पित्त होगा, विंड जैसा बॉडी में वात होगा, पानी जैसा नहीं तो चांद जैसा बॉडी में कफ होगा. तो सूरज डिसअपेयर हो गया तो हम बता सकते हैं नहीं पित्त भी डिसअपेयर हो गया. ऐसा नहीं होता है ना, because this is compared with the external effect. We Ayurveda, ठीक है. So इसीलिए आप लोगों को लगातार काम करना. लव आयुर्वेदा, उसको पढ़ो, एनालाइज. कभी कभी क्या होता है, हम अभी पढ़ गए तो हमें प्रॉपरली उसको समझ में नहीं आए श्लोक क्यों पढ़ना है जनरली द क्वेश्चन श्लोक को क्यों करना है इट इज द बेस्ट स्ट्रक्चर्ड वे टू रिमेंबर द थिंग्स श्लोक बोले बेस्ट स्ट्रक्चर्ड वे इजीएस्ट वे टू रिमेंबर द थिंग्स नहीं पढ़ा तो नहीं मिलेगा बाद में at the age of 40 or 30 after the 30-35 it is very difficult to by heart the श्लोक इसलिए एक कहावत है पठ्यते अर्थम पश्चात ग्राह्यते अभी पढ़ो आपका काम है अभी पढ़ो पर उसका एप्लीकेशन समटाइम्स लेटर यू मे अंडरस्टैंड व्हेन यू सी ए पेशेंट डायरेक्टली कम्स टू तब आपको श्लोक ढूंढने में मुश्किल हो जाएगा तो जो श्लोक आपका मन में है तो when the patient is in front of you you can instantly recollect है ना इसलिए you need to do lot of work and strengthen your knowledge don't leave the physics chemistry biology background उसको भी हमें इस पे incorporate करना है the scope is entire world okay so because I know when I work in All India Institute of Ayurveda as it is Apex Institute of Dentistry every day we will be having some of the other kind of institutions last week में आया था USFDA से 7 डॉक्टर्स का 7 लोगों का टीम आया they want to know about Ayurveda USFDA उसके पहले आया था 27 मेंबर्स का वर्ल्ड वाइड नेचुरल प्रोडक्ट का CEOs उसके पहले आया था Canadian minister health minister he want to do some integrative practice in so ऐसा ही है entire world is now looking into it तो हमें properly equipped हो we need to date our knowledge we need to develop our skills ऐसे ही BAMS खत्म करके चला गया कुछ फायदा नहीं another thing हम जब कल्टीवेट करते हैं ना कुछ तो बैंगन का कल्टीवेट करते हैं तो उसका पौधे रहते हैं बीच में छोटा छोटा दूसरा पौधे भी आता है ना तो क्या करेंगे हम मेन पौधे को रखेंगे दूसरे को निकाल के फेंक देगा क्योंकि दूसरा फिर इसको ट्रबल करेगा ना ऐसा ही हो जाएगा unless and until you gain proper knowledge develop your skills this शुरू करो you are in the best place wonderful infrastructure wonderful teachers जब हम BAMS को गए थे हम रेंटेड बिल्डिंग पे उस पे इंस्ट्रूमेंट्स कुछ नहीं था ऐसा क्लासरूम नहीं था के बैठते थे तो यू हैव ए वंडरफुल इंफ्रास्ट्रक्चर हॉस्पिटल ऑलरेडी है बड़ा अच्छा क्लासरूम है गैलरी क्लासरूम है ऐसा भी हमारा इंटरैक्टिव बोर्ड है ये सभी हमारा ड्रीम्स था उसी पे हम OHP पे लिखते थे OHP शीट पता है वो शीट में तो डिस्प्ले होता है वो भी लास्ट से फाइनल ईयर पे सभी आ गए कैसा तो नाउ यू हैव ओनली थिंग यू हैव टू डू इज लर्न यूटिलाइज मैक्सिमम लोगों को चुप रहने बैठने के लिए मत छोड़ो क्वेश्चन पूछते रहो इसलिए चरक संहिता में देख रहे श्लोक चरक संहिता सिद्धिस्थान चक्रवाणी कोट कर रहा है दूसरा एक अप्रदुष्टेन भावेन प्रसन्नेन अंतर शिष्येन सम्यक पृष्ठस्य गुरोर्बुद्धि प्रकाश क्वेश्चन क्यों पूछना है खाली आपका नॉलेज के लिए नहीं है आप सही क्वेश्चन सही टाइम पे सही ढंग से पूछा तो क्या बेनिफिट है गुरोर्बुद्धि प्रकाशयति तो कभी कभी सभी को जानना जरूरी नहीं आप अभी कुछ क्वेश्चन पूछा आई मे नॉट बी एबल टू आंसर इफ इट इज बियॉन्ड माय तो वो क्वेश्चन मुझे डिस्टर्ब करेगा मैं आज मुझे पता नहीं तो आज जाके नहीं तो ऑन द वे आई विल सर्च नहीं तो जाके मैं टेक्स्ट ढूंढूंगा क्या है इसका मीनिंग तो इट एनहांसेस माय नॉलेज हाँ Yeah, that's what I told. I have some diseases so easy to communicate. That's why I explained the story of a psychiatric situation. So similarly, Panchkarma has three different aspects. One is the promoting, preventing, and curative. So it can be utilized for promotion, it can be used for that curation. Yes, in all the diseases, there is involvement of Panchkarma. The treatment divided into ways Shodhana for all the diseases. Shodhana is the typically level if the dosas are highly initiated, go for Shodhana, then go for Sharma, internal. Yes, depends on the severity of it. And apart from that, there is the concept of seasonal purification. Seasonal purification for the healthy individuals. Healthy individual को शोधन करते हैं, वमन कराते हैं. This is the season for वमन. Season ऋतु के अनुसार वसंत ऋतु में वमन करना है, शरद ऋतु में विरेचन करना है, and वर्षा ऋतु में कर्षण. This is the for the healthy individuals. अभी वसंत ऋतु actually फरवरी मार्च अप्रैल अप्रैल 2 महीने वसंत ऋतु है. कफ बढ़ जाता है उसी टाइम पे. कफ बोले तो खांसी नहीं, कफ दोष बढ़ जाता है, उसको निकालने के लिए वमन करना. तो ऑल ऑफ यू कैन अंडरगो. हम अभी बड़े शूट में अभी वमन का कैंप शुरू किया है. तो फॉर पैटर्न इवन स्टाफ को जॉइन तो उसका एक वेरी इंटरेस्टिंग ये भी उसका बेनिफिट आचार्य सुश्रुत ने बताया है. कासोपलेप स्वरवेद निद्रा तंद्रा से दौर्बल्य विषोपसर्ग. तो खांसी नहीं आएगा, मुंह पे बैड स्मेल है तो नहीं आएगा, स्टिकीनेस इन द माउथ वो नहीं आएगा, विषा डिफरेंट काइंड्स ऑफ टॉक्सिक पदार्थ बॉडी में वो उसका प्रॉब्लम नहीं होगा. औपसर्ग कंटेजियस नहीं आएगा. ये सभी वमन हेल्थिंग इंडिविजुअल्स रेगुलरली एवरी ईयर करते हैं. These diseases can. And interestingly, you know, the COVID pandemic, the many of the things are related with respiratory involvement was there, digestion related, GI involvement was there, right? And it is contagious in nature, and we can say there is some toxic involvement. So, COVID शुरू कब हो गया था? फरवरी मार्च में शुरू. उसी टाइम पे ही वमन का भी proper time. So, this seasonal purification, seasonal Shodhana karmas may prevent these kind of pandemics also if we regularly practice these things. Better. Very good question. Ayurveda survived since last 400 years. Even with Mughal invasion, even with the British invasion, even with the, they tried to destroy Ayurveda. उसके बावजूद भी वो पर साल भर आयुर्वेदिक बुक जला के गर्मवारी उतारते. उतना लिटरेचर का हमारा वो सभी फिर भी आयुर्वेद. Right? Why? Because its principles are very strong. It is near to the human kind. Right? So, उसका resources are easily available, which is not having any side. And the knowledge is very structured, very scientific. मैं बात किया था big data big data analysis. आपका Google फॉन्ट पे आपको आएगा, इस बार अपडेट आएगा ऐसा सब. तो क्यों आ गया? क्योंकि लोग नेक्स्ट टाइम इसका अपडेट आएगा दूसरा कुछ, वो कौन बता रहा है इनको? गूगल वाले, बिकॉज दे एनालाइज द यूजर इंटरफेस, हाउ द पीपल आर यूजिंग लार्ज डाटा, एंटायर वर्ल्ड, उसको एनालाइज करके उसका बेस्ट आउट ऑफ द सो बिग डाटा. सिमिलरली आयुर्वेद में बिग डाटा व्हाटएवर मेंशन इन द टेक्स्ट, तो सोरियासिस का मीटिंग में कुछ बोलते हैं, उस पे एक मध्य शक्ल जैसा होता है, जैसे उसी टाइप के आचार्य ने लिखा. उनको कैसे पता चल गया? वो ये बताए नहीं, बिकॉज आफ्टर रिपीटेड सीइंग वेरियस काइंड्स ऑफ एनालाइजिंग वेरियस काइंड ऑफ with lot of experience, lot of experience they have written. That is why it's still valid. And artificial intelligence, that is our duty for the duty of science. Science को update करना, it is the duty of the science. हम कुछ नहीं कर रहे हैं तो कभी कुछ नहीं, but science will remain like that. उसका death कभी नहीं हो, because it is the Indian science are like they are sanatana. They are start from Sukshma to Stula. Right? They start with Parmanu to become human being. The modern science से नीचे चला है. तो आर्टिफिशियल इंटेलिजेंस के बारे में मैं वो बताया. हमारे पोस्ट ग्रेजुएट स्टडी अभी शुरू हो गया है. उससे एक स्टडी ऑलरेडी हो गया था. डेवलप टू आर्टिफिशियल इंटेलिजेंस रिलेटेड पूरा एक डेवलप किया था. अमन की वैरायटी के तो दूसरा एक अभी मेरा एक पीएचडी स्कॉलर कर रहा है इन कोलैबोरेशन विद आईआईटी जोधपुर के साथ मिलके आर्टिफिशियल इंटेलिजेंस टूल फॉर द असेसमेंट ऑफ द वमनकर. इसका कैमरा देखते, इमेज प्रोसेसिंग, फोटो वीडियो प्रोसेसिंग, डिफरेंट तरीका है. तो ये सभी हम कर सकते हैं. नाउ द नॉलेज इज ओपन टू, क्योंकि एवरीथिंग इज क्रिटिकल, कोई बाउंड्रीज नहीं है. कोई नहीं बताएगा मैं सिविल इंजीनियर पढ़ूं. इफ आई विश आई कैन लर्न, कोई मना नहीं करेगा, क्योंकि एवरी ट्यूटोरियल इज कुछ को पैसा देना है, कुछ ऑनलाइन फ्री ट्यूटोरियल जो आपको डिसाइड करो. आप इंजीनियरिंग कर सकते हैं, केमिस्ट्री पढ़ सकते हैं, कोई मना नहीं करेगा. तो नॉलेज, गेनिंग नॉलेज इज ओनली थिंग you should have a strong set. Yeah. Okay. I think with these words we will conclude. Yeah. 12. I stopped it.